Good morning, ma'am. I am going to perform external eye examination, and things to remember: perform hand hygiene, provide client privacy, and inform the patient what we're going to do. Materials needed: we have clean gloves, pin light, object, um, card, and newspaper. Um, into the procedure: inspect the eyelids and eyes for position and appearance by blinking. Sir, can you blink your eyes? So, the eyes is lid margin moist in pink, lashes short in curve, in space with lower margin of the bottom edge. Um, Second is we have to inspect the conjunctiva and sclera for clarity and appearance for separating eyelids with thumb, index fingers, and asking the client to move up, down, and side into the other side. Sir, we have you have to move your eyes up, side, and down. Up, side, down. The bulbar conjunctiva is clear with tiny vessel, and visible peripheral conjunctiva is pink with no discharge, and blue, white. Um, Inspect the cornea using the oblique lightning for appearance. The cornea is transparent, smooth, and moist. Now we have to inspect the pupil for the following: the shape, equality, and the color. The shape is round, the color is uniform, and equal. Um, Now we have to inspect for lens for clarity. This clear. Um, Inspect and palpate the lacrimal apparatus. Appearance. Response to pressure applied to the nasal side. Sir, did you feel any pain?
No.
Mm. Puncta, small elevation of the nasal side of the upper and lower lids mucosa is pink, and there's no tenderness or discharge noted when pressure is applied. Now we have to check for the visual acuity. Check the distance vision with Snellen chart, 2 to 20 feet from the client. We have to cover the eyes Then you have to read the Snellen chart.
Read. EPFTOZLPEDFDEDFCZP. Red. FELOPZDDEFPOTEC. Red. LEFODPCT FDFLTCORCRCICRT2.
The client read the Snellen chart without difficulty. And now we have to use a newspaper to read about 14 inches. 14 inches.
Initialize calculator setting. Perform the following procedure to initialize the calculator. Switch, return the calculation mode to COMP, and return to all settings including setup menu setting to their initial defaults.
The client read the prints 14 inches without difficulty. Now we have to check the peripheral visions. Face the client at a distance of 2 to 3 feet. Client and examiner look directly ahead and cover the eye directly opposite to each other. Confrontation test. Ask the client to see now if the eye examiner if he sees the object is coming.
Now. 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 Now.
Client and examiner report seeing object at the same times at approximate periphery. Ask the client to stare to check the accommodation. Ask the client to check to stare at an object 2, 3 to 4 feet away and move the object towards the client's nose. Sir, can you stare to the object? The pupil converge and constrict as subject moves towards the nose. Pupil response is uniform. We have to check for the extra ocular movements. Ask the client to follow the object as it is moved in 6 cardinal fields.
Noun. 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 Noun.
Both eyes moves in a smooth, coordinated manner in all directions. Now we have to check the eyes for the response. Check the check check the cornea for light reflex by asking client to look straight ahead and then shining the light toward the midline. Check the direct pupil's response by asking the client to look straight ahead and approaching each eye client side with a pin light. Check for consensual pupil response by asking the client to look straight ahead and approaching eye from client side with a pin light. The eye is constricting with pin light, and um, reflection of lights can noted at the same location on both eyes. Illuminated to the pin light became the eyes constrict. Pupil opposite one illuminated constrict simultaneously. Now we have to check for the abnormal movements using cover or non-cover test. Ask the client to look straight ahead, covering one eye side of the card and covered and uncovered eyes for movement. Uncovered eye does not move as opposite eye is covered. Covered eye does not move as covered is removed.